Two internationally trained dentists. Same degree, same starting point. One follows the most popular pathway, the other chooses based on strategy. 3 years later, one is still trying to pass exams, the other is already licensed and practicing. Same starting point, different decisions, different outcomes. Most candidates don't fail because they are not capable. They fail because they choose the wrong pathway for their profile. In this video, I'll help you decide which pathway makes more sense for your situation based on variables that actually determine your outcome. Let's approach this strategically. Many candidates choose their pathway based on what friends are doing, what seems popular, or what appears easier. That's not strategy. This is where most candidates lose time, not in the exams but in decisions. Choosing the right pathway requires evaluating your profile realistically. There are 5 key variables you must assess: language proficiency, financial capacity, immigration status, academic competitiveness, and risk tolerance. Language is not just about passing exams. It determines which opportunities are available to you. In the NDEB equivalence process, you are not required to submit IELTS or TOEFL. However, exams are conducted in English or French, and strong comprehension is essential. For university-based pathways, language requirements become formal. This may include IELTS, TOEFL, and recognized French exams depending on the institution. Canada has both English and French dental schools. The language of instruction determines the requirement. Many candidates underestimate this and only realize it after losing time in applications. Language is not just a requirement, it is a strategic filter. Every pathway requires financial planning. The NDEB pathway includes exam fees, preparation courses, study materials, travel, and time without stable income. Over time, many candidates invest tens of thousands of dollars, but cost alone is not the right way to evaluate this. Some candidates invest heavily in preparation and still require multiple attempts. Others invest more upfront in university pathways but reduce uncertainty. This is not about cost, it is about how you distribute risk. University pathways require tuition, living expenses, and full-time commitment. The question is not just, can you afford it? The real question is, can you sustain the process? Immigration is one of the most underestimated variables. It can completely block certain pathways, regardless of your academic performance. The NDEB pathway allows you to start from your home country. University pathways typically require a valid student visa and full compliance with institutional and immigration rules. Some programs prioritize permanent residents and Canadian citizens. Ignoring immigration constraints can delay your entire plan. Not all pathways reward the same strengths. The NDEB pathway is performance-based and exam-driven, but progression is not linear. According to the NDEB annual report, AFK pass rate is approximately 42%, ACJ pass rate is approximately 61%, and the clinical component of the NDAC is around 40%. This means many candidates require multiple attempts to progress. University pathways, on the other hand, are highly competitive. They require strong academic performance and in some cases additional exams like ADAT. The Bridge program has limited seats. Specialty programs have even fewer. Choosing the wrong pathway can place you at a structural disadvantage from the start. Different pathways carry different types of uncertainty. Some candidates prefer structured environments with clearer timelines, and others prefer flexibility and are comfortable with multiple attempts. Neither approach is better, but choosing the wrong one for your personality leads to frustration and delays. At the same time, the number of candidates entering the process remains high. Over 1,400 new candidates enter the system in a single year, and more than 1,200 dentists are certified annually in Canada. There is no single dominant pathway. There are multiple routes with different levels of risk, time, and practicability. If your strength is exam performance, the NDEB pathway may be a better fit. If your strength is structured learning, university pathways may offer more stability. If you are highly competitive academically, DDS or specialty programs become viable. If your priority is flexibility, the equivalence pathway allows you to start from your home country. The NDEB pathway is not automatically the best. The university pathway is not automatically superior. The bridge program is not automatically faster, and the specialist pathway is not automatically more secure. Each pathway is optimized for a specific type of candidate. The goal is not to choose the best pathway. The goal is to choose the one that minimizes risks for your specific situation. But before committing to any of these paths, there is one more question you need to answer. Is it actually worth it? Because becoming a dentist in Canada requires time, money, and uncertainty. In the next video, we'll break down real dentist earnings, job opportunities, market demand, and the reality behind the numbers, so you can decide if this journey makes sense for you.